Any more? Okay. All right. Thank you, everybody. Thank you for coming along to the Grassroots Award webinar. My name is Mac. I'm a Public Health Research Programme Manager at the Specialist Centre for Public Health. The centre is based in Newcastle. You might be able to tell from my northeast accent, but we do operate nationally, and we're funded by NIHR. So for anyone who doesn't know, that's the National Institute for Health and Care Research. I'm going to try not to throw too many acronyms around today. I wanted to start with a bit of a backstory about this award and in preparation for today. So this is the second time we've offered Grassroots Award funding. The first round was in June of this year. And since then, we've utilised feedback from applicants about how to improve how we operate this call. And we've also changed the eligibility criteria. So I will share with you some information about that later on and what's changed. I've recently taken over the delivery of this funding call and of looking after the awardees. And I think everyone on the call can appreciate when you get given a new piece of work, it can be a bit daunting. So I have some fantastic colleagues on the call to help me with, if you have any questions at the end and anything particularly tricky, they're going to help me to tackle those. So I'll try my best, but I'm sure you will challenge me at some point. So what I have been doing in preparing for today is I've spoken to colleagues who've taken part in the call before. And actually my colleague Brady, who's on the call, gave me the perfect summary. She rounded up, I said, what's it like, this Grassroots Award? And I thought it's the best way to start if Brady tells you what she told me. So go for it, Brady.
Hi everyone, I'm the Data and Impact Manager at the Special Centre in Newcastle. And when Mac asked us about that, I'm like, oh, I love this one. This is my most favourite award. So we do a lot of awards in the Special Centre for Public Health. But this one I really like because it's aimed at people who are at the very early stages, what might be your very first steps into research or early stages of research. And we've got people from all different backgrounds who are doing all different kinds of things. Those like develop new research skills. So it might be presentation skills or attending a placement. And one of the things we found is there has been barriers for people who are working in public health to kind of take those first steps into research. And that might be, you might have caring responsibilities, perhaps you're a single parent. You may work in a small team and there's no capacity for you to be able to go off and, do something else outside your current role. And another one that we had is we have some people who live in rural areas, so there may not be a university in their town where they can access this. So some of by bringing the grassroots in, we're kind of given those opportunities, which is why I love it.
Thanks, Brady. I hope you all feel as inspired as I did hearing that, taking on a new piece of work. It was just such a lovely start to hear from Brady, like it's her favourite and it just does something particularly special. Thanks, Brady, so much for that. So let me take you through what we're going to cover in this webinar. So I'm going to tell you a bit of the context and the vision of what the Grassroots Award is all about and why we created it. The funding call details, so what is our offer, what activities could be included, who is eligible, and what are the timelines for this funding call. I want to tell you a little bit about how applications are scored. We're pretty transparent about those sort of things here at the Specialist Centre for Public Health. We want you to know what strong applications look like and what the panel process looks like. And then I've got three fantastic people who in very short notice said that they would help me out by telling you what it's been like to be a Grassroots awardee, and they're going to join me later on in the call and go through that. And really hearing from them is far better than me articulating all these details. It was really great for me to hear what people have been doing with that funding and how they've found it. Then we're going to just talk about the future Grassroots Award funding calls, of which there will be some more. And I think it's important that you know that, because if now isn't the right time, it's helpful for you to know that there'll be other opportunities. I'll give you our contact details and then there'll be opportunity for questions. So you can pop questions in the chat at any time. There is a chance I might end up covering the content later on in the webinar. Oh, did I lose signal there? Anyway, I'll carry on. I don't know where I got to. You can pop questions in the chat. Typical that you start a webinar and then the internet goes. Or you'll get the opportunity to ask questions verbally at the end. And my colleagues Brady and Ollie will be monitoring that chat all the way through. I would say if you have a question specific to the eligibility when we get to that stage, I would avoid putting those in the chat because we can't confidently answer eligibility questions via that text mechanism in the chat. We will have an opportunity for people to book in slots for a drop-in, really short meetings with us to cover everything and make sure that we're giving you the best possible advice. So if you do have individual eligibility questions, keep those to yourselves and book in to talk to us. If you have a broad eligibility question you just need clarification on, then I appreciate you can put those in the chat. Fabulous. So What I wanted to do for anyone who doesn't know who we are, apologies if you do already know about the centre, is just give you an extremely broad overview. Who are the Specialist Centre for Public Health and what is it that we do? So I mentioned that we're funded by NIHR. We have various pillars to our work that I'm not going to go into detail about, but my colleague Ollie is going to pop our website link into the chat. Our pages are not Googleable, so it's worthwhile opening that link and having that open to review after the webinar and maybe bookmark that page. It also might be that the chat is not available to you when this webinar ends. Everybody's team seems to be set up differently, so it's worthwhile opening that. And then you can look at this in more detail. But essentially, everything we do at the Specialist Centre is focused on supporting there to be more public health research outside the NHS. So we support local authorities and VCSE organisations. We want them to feel confident to do research, and we want to promote curiosity across organisations to want to instil evidence in their decision making. So we do that through local authority support and resource, a research design service, offering training, helping local authorities and organisations to develop their research governance. We're offering support in research delivery now, and in public and community partnerships. A really important part of every bit of research should involve the public in a meaningful way. And we support all of that activity in a variety of different ways. So I recommend looking through our website after today. The broadest of overviews. So now let's just focus on the Grassroots Award. So the vision behind this funding is that it is personal short-term awards, which means the application form is completed by an individual, not at an organisation level. We are seeking to stimulate interest in public health research by giving people the space to buy out time and release them from their day-to-day activities to develop their skills and knowledge in research-related activities. We want to foster a culture of research within public health at a grassroots level. So for people at the start of their research journey with little or no experience of research, I will elaborate on what I mean by that. We're looking to empower individuals so that they can contribute in innovative and informed practices. And overall, you know, many of us on this call are seeking to improve public health and reduce health inequalities. For the individuals, the benefits are that this call is very flexible. You'll see that the money can be used in a variety of different ways. It's inclusive, meaning what Brady mentioned, we're actively addressing and mitigating challenges that tend to stand in people's way and prevent them from being upskilled in research. And I'll explain what I mean about that later on. It's all about enhancing knowledge and skills, building networks and connections to continue this research journey after the award, and basically to further people's careers. The benefits to employers is that through supporting these applications, they demonstrate their commitment to championing research in their organisation. Obviously, their staff go on to personally develop, and we've bought out that time for them to do that. And awardees are going to help us shape the future of what the Specialist Centre can do, and that ultimately could impact the wider impact we can have on your organisations at a higher level. The other thing that we're aiming to do is to complement what the NIHR Academy already offer. So there are various career development opportunities, and you'll see on this slide that grassroots eligibility sits at the very earliest stage. We've done that deliberately. We're offering something different. We're going right to the early stages. And the ideal scenario is that there's a trajectory that people then have the opportunity to move their way through further career development opportunities if they so wished. So we already have some awardees from June who are seeking to apply for a local authority short placement award for research collaboration, or an LA Spark. That's fantastic for us to know that, because it's doing exactly what we hoped it would do. But we know that regardless of whether you take on a future career development opportunity, there will be trajectories through the connections and skills that you learn by using this award. So we're hoping that we have succeeded in complementing that existing offer. That is the context and the vision behind why we're offering this funding and this call. Now let me tell you what we're actually offering. So we've got the money to support potentially over 50 applicants from this call, depending on the strength of the applications that we receive. But only one person per organisation can be successful per round at this time. That might be something we seek to change. It depends on how many applications we receive. Multiple people from the same organisation can apply, but ultimately only one will currently be successful, unless it's part of a joint application, which I'll explain a little bit more about. The award itself is £5,000. to up to £5,000. I kept saying 50,000 when I was practicing today, and I need to make sure I get that right. My other funding call is £50,000. Let's be clear, it's up to £5,000 to be used flexibly, typically over a 3 to 6 month period. But if you did need longer and could justify that you would be undertaking activities within that price envelope over a longer period, then that is acceptable. And when you are looking for potential activities to do with this funding, you'd have to be wary that that activity needs to commence between the 16th of March and the 30th of June next year. That's the award specific details. And that £5,000 can be used to cover salary costs, to buy out time for you and release you to undertake activities. And it can cover the learning activities themselves if there was a cost associated with those. Or if you can get time out from your role to do this and only want to use the money towards learning activities, that's fine too. The vast majority of applicants have used some of the money towards releasing them from their day-to-day role. So this is the different activities you could apply to undertake. That salary support is the first bottom line. You could seek to use the money towards undertaking a short placement with a research team who are undertaking public health research. Now, it would be up to the individual to have sought out that opportunity, found somewhere that would be willing to have them as a placement participant. So it could be within your own organisation and you've bought out your time to do that. It could be with a local authority, with an academic team, or one of the NIHR research teams. If you did wish to undertake a short placement, you obviously identify that opportunity, you get the support from the project team, and you outline the details of that in the application form. Or you could use some of the money towards attending a public health research conference, of which some of the money could be used to cover travel and accommodation. Another alternative is that you use the money towards a training course or development opportunity. This could be online or in person, accredited or not. A lot of people in the previous call sought to do a university module in research methods. These are all ways you seek out what's best suited to you to increase your research skills and knowledge. We would be particularly interested if people were seeking to do training in public and community partnerships or inclusive research design, because that's something we care a great deal about. I must add a little caveat. If you, for example, are a data analyst and you apply to undertake a training course in data management, that would not be successful by the panel. It has to be something that's going to expand your research knowledge and skills. You could apply for funding for a professional mentor or coach, but a little word of warning here. As I said, we're always transparent about these things. If you were to apply for payment of a particularly expensive coach using up quite a bit of this funding, and it's particularly if it was someone within your own organisation, you would need to provide significant detail as to what the value would be of this offer. There was some concerns from the panel in the last round about the cost of mentors and coaches and what additional value they bring. So it's just be really clear and specific if you wanted to use part of the money or all of the money towards a mentor or coach, the research you've done into that, the connections you've made, and what value and benefit you'd be hoping to bring from that. And then the final thing to mention of activities you could apply for is, I mentioned earlier, the vision of this award is to be inclusive and overcome challenges that people face in undertaking research development opportunities. So you could use that money towards additional childcare that's required in order for you to take part in an activity, so attendance at a conference or additional work hours. Or you could apply for accessibility support, such as, just an example, the British Sign Language interpreter or alternative. Let's see, is there anything else I wanted to mention to you? Oh yes, the things that aren't included are the costs of equipment or the costs of our software license, for example. So if you were to apply to undertake a Power BI training course and explain to us the value that course was going to bring to your research development skills, if you then said that within those costings you wanted us to cover the Power BI license at your organisation, that would be removed from the application. That would fall outside of the scope. So that's an example. And yeah, long-term equipment would also have to be covered by your own organisation and not by this funding. Fabulous. So I'll now cover the eligibility. I did mention if you have specific eligibility questions, please come and chat to us on a drop-in and don't put those details into the chat, because we just won't cover them while we're in a group setting. And I want to really do justice and give you the most accurate information. So individuals applying for the Grassroots Award need to be working in public health or a role that's tackling the wider determinants of health. Often people working in the public health department of a local authority aren't the people that can apply for these opportunities, but wider colleagues can. because of the rest of the eligibility criteria. So individuals must be employed by a local authority. If you have a HDRC, you can't be funded by that HDRC, Health Determinant Research Collaboration, or you have to be working for a non-NHS provider or VCSE, but that VCSE or non-NHS provider must be commissioned or provided a grant by a local authority to deliver a public health service. So we do ask you about that on the application form, and you would need to give us those details to explain what you're commissioned to do. So we mentioned that we're looking for people with little to no research experience. So we're asking for people to have a degree or equivalent experience. So if your job description was to detail that your role requires a degree or equivalent experience, then you know you meet that criteria. But if you, in the past, in our previous round, if you had any postgraduate qualification, you weren't eligible to apply. This time around, we've changed it. If you have a postgraduate qualification in a health or social care related subject, or in a subject that is directly related to your current role, you would still no longer be eligible. But if you have a postgraduate qualification in English literature or astrophysics, or a subject that is not health or social care related or related to your current role, then you can apply. And that's directly taken from the feedback we received and wanting to make sure that this is the most inclusive call we can make it be, while still retaining the fact that this is for people with little or no research experience. So I hope that bit is clear and makes sense. I did mention that you could apply jointly with a colleague. So if you have a colleague who is has similar learning interest to you, similar background, and you could both take part in a training course or both take part in something where you would utilise that £5,000 together, you could apply jointly, but it's still within that £5,000 envelope. You wouldn't be able to apply and seek two lots of the funding. And it really is about explaining in the application form that your needs are similar. Is there anything else I wanted to cover? No, I think that's everything. So what I wanted to do was just to stop the slides for a moment and show you, hopefully you can see these web pages. So Ollie is going to drop two links into the chat. One is to the funding call details, but what I really wanted to draw your attention to is, so we are the Specialist Centre for Public Health. This is our homepage. If you go to Local Authority Support and Resource and find the grassroots, the funding call, January 2026, funding call 2. This is all the information about the details of the award and how to apply. But what's really important here is that there is an award description. Everything to do with eligibility, the activities you can take part in, what sort of things we've funded previously is all on this second page. And I don't want anyone to miss that. The application form is downloadable from here as well. It is a Google site, and so some organisations' firewalls prevent them from viewing these pages. Please do email us. Ollie's going to drop the email address into the chat later on. You can just email us and we'll send you all of these details and the application form to your email address if you can't access these pages. We apologise for that. It can be a real pain that not everybody can view those. But yeah, what's important is there's two pages to review: the funding call and the award description. So the timelines are that the call opened on Tuesday of this week, the 11th of November, and the call closes on the 27th of January at 5 p.m. The panel is going to meet on the 3rd of March. That gives us a lot of time for pre-screening and allocating scoring via the panel. We're then seeking to share our decisions and outcomes the week commencing the 9th of March. And I mentioned previously that your funding or your activity would need to commence between the 16th of March and the 30th of June next year. So let me talk you through how applications are scored and what that process looks like. So I just mentioned that we operate a pre-screening process. So internally, we review all applications to make sure they meet the eligibility. So what previous research experience do you have? Are you applying within the £5,000 window of money? What's the timescale you're looking to undertake your activity over? Is it 3 to 6 months? So have you justified the need for longer? Is the start date prior to the 30th of June? And do you work for an eligible organisation? We're looking at all of that information as part of the pre-screening and your previous qualifications. Only applications that pass pre-screening are then passed to our panel. So a little bit about the panel. They are a mix of people from the Specialist Centre, academia, local authorities, VCSE organisations, and we do a conflicts of interest check before anyone starts to score applications. 2 panelists will score each application. Their scores are compared and then discussed at the panel. And there is a fundable threshold for the score, but obviously additional conversation has to be had if 2 different or multiple individuals have applied with a fundable score, but from the same organisation. We would then be comparing applications to decide who would get the successful outcome. The score for the applications is based on the 3 main qualitative questions on the application form. That's A, B and C on the form. And there's also a second score for a series of extra things that we look at, and that just helps us to prioritise. We call these inclusion and reach, and these are the most important factors, the top priority reasons we'd want people to get this funding. So that's people with absolutely no previous experience, first step into research, not registered with the UK Public Health Register, never held an NIHR Research Career Development Award before. These are all questions on the application form. If you plan to use the award towards accessibility related costs, you'd get an extra score. And if in any way your planned activities could touch upon or impact wider colleagues, so if you talk about train the trainer and passing on knowledge to others, an extra score would be added to those. So this is a first score for A, B and C, and that's the main scoring part, but there is an additional inclusion and reach, and we wanted to be really transparent about how that scoring works. So the 3 questions are essentially, what are your motivation behind applying? We deliberately put all of the application guidance in the application form itself. The bullet points are there for you to follow. Sometimes writing application forms can feel really hard, and avoid vague is what I would say. Give us as much detail as possible. Tell the panel a story about you. Why are you applying? What value is this going to bring? What enthusiasm are you bringing to this? What's the details of what you're hoping to achieve? What's your backstory? What opportunities have you missed out on prior? What barriers have you faced? The panel in June fed back via a chair's report that the unsuccessful applications previously didn't provide enough detail, and they didn't provide a timeline of when they expected to undertake their activities. And maybe it was either over-ambitious or unrealistic what they were hoping to achieve. So those are some things to bear in mind. So there's the award plan and then the intended outcomes, what you would hope to do after this. Really think through what activity you want to take part in and what would the next steps be, and paint that lovely picture for the panel. The more detail, the better, is the best advice I can give you. And all of these notes, as I say, are on the application form itself to help you give the most thorough answer. The word counts do matter, just so that you're aware. So I just wanted to highlight that, the beautiful thing about this award call is that although we're looking for people with little to no research experience, that can be people at all different seniority levels and trajectories in their career. So we've had successful applicants from chief operating officers to food insecurity partnership officer, performance improvement analyst, policy officer, health and wellbeing advisor. It really is inclusive in that there's people at all stages of their career applying for these awards, which is just really beautiful. And there is no weighting in the scoring based on what your job title is. This is to show you how varied this is and how varied we are in offering this call out. Again, there's no weighting behind what activity you apply for that's more successful than the other, but just to give you an idea of the sorts of things people have applied to do. So 10 applicants back in June were successful applying to undertake training, 5 for a university module, 3 to undertake a short placement with a research team, 5 to take part in being in a research project group team and actively participating, and then 5 were covering something to do with public and community partnerships, whether that's training or being part of a research team that's focused on that. So again, doesn't dictate who's successful and who's not. It's just to show you that there's a real variation of the activities that people apply to do, which is really great and a huge benefit of the flexibility of this award. Now then, I'm going to stop talking, which I'm sure will be a relief for everyone. As I mentioned earlier, I reached out to people a week ago, extremely last minute, to say, please, can you come and talk to people about being an awardee of the grassroots and tell people what it's really been like? And these 3 fantastic women are doing that with me today. I should say to VCSE colleagues on the call, it is just by chance that the 3 people talking today from local authorities. It's entirely my fault for leaving it last minute and people not being available and other people happening to have the time and being kind enough to come and speak. It shouldn't really reflect any difference. The examples that we've got really showcase the flexibility and the reasons why people apply. So I think it's still relevant to everyone. But if you did have any questions about any other colleagues from VCSEs that have applied for that, you can certainly chat to us about that during the drop-ins that we're going to offer. And we could even put you in touch with successful awardees if you wanted to talk to anybody else from a VCSE who's been successful. Okay, so the first person that's talking today is Emma, and I can see she's on the call. I'm so grateful, Emma. Emma had just returned from maternity leave when the call opened earlier this year. I don't know how you do it, Emma, having 2 kids and working. I just think you're marvellous. And I really enjoyed talking to Emma and her telling me why she applied for the award and what she's been doing. So take it away, Emma. Thanks so much.
Hi everyone, thank you, Mac. So I'm Emma. I work at Kirklees Public Health Improvement Team. So yeah, as Mac said, I came back from maternity leave late March, and my manager sort of sent me all the emails to do with the Grassroots Award. And I'll be completely honest, research is something that's never floated my boat. I've had very little experience. I did a literature review as part of my nursing degree, and we did it as a group activity, and I just found the whole thing very stressful and chaotic, and I don't feel like I sort of learned any foundation knowledge of research. We just literally muddled through, came out the other side, and I just thought, wow, don't like research. So yeah, I had a bit of a negative perception, and like Brady mentioned, there were lots of barriers that I just felt were sort of impossible to overcome. I also got put in a project team when I came back to work, and that was research based. So it was working on a local population health survey. So in the meetings, there was lots of discussion around survey design and research methods and data analysis. And I just felt a bit out of my depth, like I couldn't properly contribute. So when I read through the criteria and the eligibility of the award, I just felt like it was such a great fit for me, and especially like when I'd just come back to work and been put on that team. So I think the biggest thing for me that stood out was that it's so flexible and you can make it work for your situation, whatever that may be. So yeah, I've got 2 kids, I work part-time, but it's still something that was accessible to me. So we've got an amazing person working in the council. I'm going to have to give her a shout out. She's called Katie Harrison. She's our research and evaluation lead, and she was absolutely amazing and supported me through the application. She listened to sort of my work streams that I were involved in, my current situation at home, and went away and brought me some options and costs along with those options. And yeah, I couldn't have done it without her basically, but I decided in the end that I wanted to do a master's module. So I used the money to pay for the module itself, and it's also bought my time out as well with the council. So that is a distance learning module with Sheffield University that I started in September. And it's the Introduction to Research Methods course. So it is basically what it's described as. And I get protected time each week. I log on and I work through the content, and then I've got to write a 2,500 word research proposal sort of over the Christmas break. Yeah, and on reflection, it's probably harder than I expected, but I think that's just because I haven't been in academic learning for a long time. But I've fairly quickly got my feet under the table, and yeah, it's such a short sort of period of time. It's September through to January, so I'm just sort of facing it head on, and I'm actually enjoying it, I think. And I already feel more confident in the meetings at work, so I'm able to recognise terminology and actually understand what people are talking about, which is a really nice feeling. So yeah, after that finishes in January, I'm then going to be doing a mini placement with Huddersfield University, where I'll be shadowing the research team there. And yeah, I think it's really nice link that I can sort of consolidate what I've learned on the module and put it into practice and actually see research being done in the real world. So I'm looking forward to that. And yeah, and I just think as well, I wanted to sort of do something that would help me in the long term as well. So I'll have a master's module at the end of it. And I'm hoping at some point in the future to do a full master's in public health, so that I can take that with me and put that towards that. But yeah, it's been an amazing opportunity. I'm really glad that I went for it, and it's just felt like there's a lot of support out there as well. So yeah, I would highly recommend. Thank you.
Thanks, Emma. That was such a beautiful description. Far better than anything I can articulate if I was, it just really solidifies why Brady said this is a really lovely award. And yeah, just fantastic details. Thank you so much.
Thank you.
And I think you need to shoot off at some point, Emma, so please don't worry about staying on the call.
Okay,
you've already given me so much of your time. I'll be in touch. Thank you so much. So also on the call is Hayley Hines, and Hayley is also going to share What I loved about talking to Hayley was she said, I really didn't expect to be successful when she applied, and then was told in our feedback from the panel, you are exactly the sort of person that we want to support. So yeah, Hayley, you're on the call, aren't you?
I am.
Go for
I
it.
am. So I'm Hayley Hines. I work for Hampshire County Council. I actually found out about the Grassroots Award really late in the day. So I only had a few weeks of getting everything together and trying to sort it out. At that point, I wasn't working in public health, but my role was funded by public health. Since then, I've transitioned to actually working in public health. So it's been really timely, really kind of well placed. I wasn't sure I would get it. One of the reasons being because of the qualifications and what you had to have. But my experience that I managed to portray in the application came through, and that is why they awarded it to me. So one of my kind of suggestions I'll give to you is, like, echoing what's already been said, really tell your story in that application, because I think if I hadn't, there's a possibility I wouldn't have got through it. So anyway, with the work that I was doing as Food Insecurity Partnership Officer, the one thing that had really come to my mind and learning about was the voices of people that was really important to actually work out ways forward. So I'd been on the peripherals of community research before, but never actually involved in it. So I put in my application to learn to train in community research. I also put in that I would do a small project around that, and also undertake spreading the word, especially to my colleagues in the council. I'd recently undertaken quite an intense qualification over a course of a year, so I knew I didn't want to do that again, but I still wanted to learn. And what this did, this really gave me the flexibility to find something that suited me and my learning style. I also have mobility issues, so I knew I couldn't attend courses, regularly. So I managed to find a course in community research, which is all online. There's video content, there's one-to-one tutorials. It really works for my learning style. And what's really good, because you've got a period of time where you can start this, I've managed to start it at a time when I've set up the Hampshire Food Alliance, where we're now really doing momentum forward, listening to our communities, listening to organisations. So I've been able to start this training at the beginning of work where we are talking to the communities, and the project I would do is a survey going out to those communities. But with the learning that I'm getting from it, the tutor in the course is also supporting me through that. So whilst I'm learning, I'm doing the real world stuff as well, which is great. The other thing it's done as well is it's opened up me having conversations with other contacts and people that I've got relationships with. So I work with Southampton University on one of their projects on their advisory board. Part of that element, there's community research. So I've reached out to them to see where I can observe and just be part of what they're doing. So again, I get that real world kind of experience. What else? The knock-on effect is I'm learning I can advocate on undertaking research with the public meaningfully. Talking to colleagues, I'm really proactive, and can speak more confidently now in saying you need to be talking to people, not just kind of deciding what you think you might need to do. What else is there? Okay. Yeah, so I can study at my own pace as well. So the course that I found is like 12 to 24 weeks. So it works really well for me. So after the award, I'd really like to start looking at behaviour change, so I can actually create from the very beginning, finding out what people want, researching all of that, and then actually putting something meaningful in place so it follows the whole journey. I'm trying to think if there's anything else you want me to say that I haven't said.
I think that's
yet.
amazing, Hayley. Honestly, you're just inspiring. I think the key thing when we were chatting was what you said, that the connections have been even more developed than what you expected. For your lecturer to be assisting you in the creation of your survey is an added extra you never expected, right? And such a benefit. But yeah, you've really sold home like the flexibility, and you're now contributing to culture change in your council by being able to advocate for everything you're learning about. Yeah, that's perfect, Hayley. Thank you so much. Another joyful conversation, learning about what you've been using the award for. So I'm extremely grateful. Okay, we have a final person who's going to tell us another example of what they've been undertaking on the award, and that is Cecilia Pugh. Cecilia, I think you joined the call. Are you there?
Yes, hello.
Fab. Go for it.
Great, yeah, hi everyone. So I'm a senior intelligence specialist in public health at South Gloss Council, basically just a fancy term for data analyst. And my main reason for applying was that I really wanted to develop qualitative research skills. So all my analyst experience so far has been quantitative, and I really wanted to learn more about qualitative analysis. So before I found out about the award, I was thinking of maybe doing a course or some sort of training, but I just knew that for me personally, it would be best to gain some practical experience so that I would gain the confidence to apply what I learn in my work. So I was really lucky to have a local authority research practitioner in my team called Sam, who's great. And he's the one who told me about this award. And he's also the one who helped identify a qualitative project with the University of the West of England, or UWE, that I could shadow. So that was hugely helpful because he just had these relationships established, and he really helped me in my application and encouraged me. So I'm really grateful for that. But yeah, so I decided to apply with that project in mind that he'd found, with the intention of using the award to pay for my time away from work, so that I could really have that protected time to engage with the project, kind of like a short placement. So yeah, I started nearly 2 months ago now, and I do about a day a week, and it's been great. The research project is a collaboration across multiple universities across the country, looking at the impact of green prescribing on various factors. Is a really big project. So in this context, what's meant by green prescribing is like urban climate adaptation strategies. So essentially initiatives to make streets and neighbourhoods greener. And the UWE portion of this project is focused on health and wellbeing impact of these initiatives. So that's where the sort of public health angle comes in. So what's really exciting for me is that I'm going to learn about a new data collection method, which is walking interviews. That hasn't started yet, but I'm really looking forward to being able to learn more about that. But yeah, it's still early days. So far I've just been assisting with visiting sites where they'll be recruiting participants and carrying out the interviews. I've been attending project meetings and generally just learning how things work in the world of research, which is just really unfamiliar to me. And as well as this, the project team that I'm working with have been really supportive and keen to make sure that I get the most out of this placement. So they've been encouraging me to attend lectures and just learn more about the theory of qualitative methods. So that's been great as well. And yeah, I long term hoping to just use more mixed methods data analysis in my day-to-day role, and sort of use the relationships that I'm building for hopefully some longer term collaborations between the council and local universities.
Absolutely amazing, Cecilia. Thank you so much. Again, like the flexibility, every individual you've heard from has said, what activity is going to best suit me? Cecilia said, I don't want to do like study. I want to practice and actually see it in the real world. What suited Hayley what suited Emma. You know, they've really looked at what they can get the best out of this call, which I just love, and the flexibility is there for you to do that. And every one of them has had some added extras. So being offered the chance to come and audit some lectures, to get support in the development of a survey, to meet new connections that will hopefully lead on to further projects and further collaborations down the line. Thank you so much, Cecilia. Honestly, I gave you so little notice to take part in this, and I'm extremely grateful. And I just think it gives people a real flavour of what this call is all about. Very, very grateful. And I'll keep in touch with you to hear more about it, because I really want to know about green prescribing. I have to say it's promoted curiosity in me, because I've learned so much about what people are taking part in. So get ready, Ollie. You're about to put loads of links in the chat. So I mentioned, if you have specific eligibility questions, we'd love to chat to you one-on-one. It could be that we have to break it to you that you're not eligible for this call, but we still want to talk to you, because there could be other ways we can work with you and make sure you're on our mailing list and hear about other things that we're working on. So please sign up for a grassroots drop-in chat. They're 20 minutes in length, and they're every Monday, or most Mondays between now and Christmas. If you can't make those dates, you can still ask questions by emailing us. So the link to sign up for a chat and select a time and date is going in our chat now. Our email address is going in the chat, so you can always ask us questions there. I'll most likely run some more drop-ins in the new year. So if there's still some remaining questions to mop up, we're happy to do that. You know, I mentioned that we're a supportive centre, and we deliberately want to make sure that people get the best out of these applications. If you want to find out more about the Specialist Centre, Ollie will drop that link in the chat one more time. And also, please do join our mailing list if you haven't already, to hear about other future calls and the ways that the Specialist Centre develops over our period of funding. So that's all the things going in the chat. Final thing I wanted to mention, you know, we really do utilise feedback that people offer us, and it just seemed like the most obvious thing when LARPs, so local authority research practitioners, of which Annabelle is on the call and is one of them, and I work with all the LARPs really closely, they've fed back to me to say, you know, if there's going to be future calls for things, can you tell us? Because actually we're supporting colleagues, and it's really helpful for us to plan our year. And it was the most obvious thing they could have said to us, but it just, we're working and firefighting and trying to get things out there and support people, and it hadn't occurred to us to give you as much notice as possible where we can. So there is almost definitely going to be another call in the spring of next year for Grassroots Awards, and then same time again next year. So if there isn't an activity that's timed at the right time now, or it's just not the right time for you to apply because you've got so many other things going on, you can wait, because you know there will be 2 other calls next year. Depending on the number of applications we receive and the strength of those applications, there could be another call in 2027. I think it's quite likely, to be honest, even if it's a small pool. We want to spread this out deliberately, because actually it's better for us as a team to make sure we're properly supporting you, but also opportunities come along at different times for different people. And some people on this call today didn't hear about the call back in June, and likewise next year, people will just found out about this at the right time. So yes, there will be future funding calls, and I think it's really important you know that. So you know what's coming up. This is the bit that makes me nervous now. I'm going to stop sharing my screen and open myself up to questions. So let me do that. Now, I haven't been monitoring the chat. So Ollie, has anything specific come up that I can tackle straight away from the chat?
We've had a few questions so far, but just questions about eligibility.
Okay, anything general about eligibility that I can answer, or is it more specific for individuals?
They've all been more specific.
Okay, I would definitely ask all of those people that have asked specific individual eligibility questions. Now that Ollie has popped in the chat that link to sign up for a chat with me, please do sign up for one of those, and we'll talk you through it, because I couldn't do it justice by just replying ad hoc now. Has anyone got a question they'd like to ask verbally, and raise their hand and take themselves off mute? It can't be possible that I've covered everything. Guys, I was so nervous that you were going to ask me things I didn't know the answer to. Goodness me. Does this mean I've done all right, Brady? Maybe we've actually thoroughly covered everything. Probably not. I should say, you know, after today, the recording and the slides will be shared. But also, there's no such thing as a stupid question. So even if you're asking for clarification on something we've talked about today, please email us. We really don't mind answering the same thing multiple times. It's better that it's clear. And I talk at pace, so I recognise I've probably covered things, and it might have been missed. So please do email us with any questions. Fabulous. Well, is there anything else in the chat, Ollie, to cover? Any other comments or anything? No. No, made Ollie's job really easy. Marvellous. Thank you, everyone. I hope that is promoted some curiosity, and that, yeah, we might see some applications from you. As I say, the call is obviously open until January, so there's lots of time, and that's deliberate because we know it takes time for people to identify opportunities. If the opportunity isn't available to start before the 30th of June, you know there's going to be another call coming up. And yeah, please do reach out to us if you've got any questions, and have a great rest of your day.